Are you depleted? This is a very important question and so necessary if you're going to regain your health and your vitality. The best way we can answer this question is to show you this analogy. If we were going to look at you like you were a vessel, you are this tank, and you are designed to be full of nutrients, resources, vitamins, and minerals. When you are full, when you have all that you need, you don't just feel healthy, you feel, well, I like the way Scripture says it, you feel the fullness of joy. You feel fantastic vitality. But we get drained, we get depleted over time. When we get depleted, we don't immediately get sick. The first thing that usually happens is people say, I feel healthy. I don't feel fullness of joy, but I feel healthy. I'm fine. But then they don't address that because they're still doing good. So the next thing they noticed is, you know what? I'm fatigued. I'm not sick, but yeah, I'm definitely noticing the strain that this is taking on me. Now, again, they don't immediately get sick if that depletion is not being addressed. The next level down, they start to have symptoms. Now, when they start having these symptoms, they will go in, they'll usually see health providers, they'll get some testing done, but they still will not test positive for any particular disease or disorder. But they know something's wrong. Now, if that level of depletion, if it keeps going down, we don't address the drain on the system, then yes, we will start testing positive for various disease processes. Now, if that disease is not being addressed at that point and you keep depleting, well, then it is kind of game over. Now, let's understand what depletes us, what drains our tank. First and foremost, let's talk about medications. Did you know cholesterol medication causes 12 different nutritional deficiencies? So just right there, somebody can be coming in and being in a relatively healthy state, but after a decade or two of being drained by their cholesterol medications, now they're starting to have other symptoms and signs. Another major one that we see, long-term digestive issues. Most of your nutrients are being absorbed in your digestive tract. So if you start having digestive issues early in childhood or early adulthood, and now we are here 10, 20, 30 years later of just the steady, slow depletion, yeah, we start to see this downward spiral of progression. Another one, it can be a junk food diet. I mean, you're just not taking any nutrients, so yeah, we don't have much to gain. One of the major things that I have seen, especially in women, is they have been going with calorie restriction and yo-yo dieting and just overall nutrient deficient foods for so long, for so many decades, that yeah, they've been just steadily depleting for a really long time. Another major one, again for women, pregnancies. Wow, whoosh, pregnancies will massively take down your energy and your fuel reserves. And even worse, most mothers, after a baby is born, now they're taking care of baby and they're not refueling themselves. This is especially dominant with women who have multiple pregnancies and did not refuel in between. So what happened is, yeah, they're fatigued because, right, all mothers are fatigued but they never refuel from being in this stage of fatigue. And then over the years, more and more symptoms are developing. And now they're getting into their 40s and their 50s, and now they're starting to test positive for these various disease processes. We're also seeing menopause. Menopause does really take a drain. It's another nutrient depletion. So even women who are coming into menopause, maybe just with some level of fatigue, now they're starting to test positive. It isn't aging, it's depletion. And the biggest one, the one we absolutely have to address, is stress. Stress requires nutrient reserves. Your neurological system uses a lot of your minerals, your vitamins, your nutrients just to fuel, and when it is under constant stress and constantly depleting the system, and mind you, your nervous system gets first dibs of all minerals and resources, Years and years and years of that can deplete the system. So what do? I use exploratory panels to test every system to find out where you are in this spectrum. Most of our patients are coming in right in this where we're having a lot of symptoms, but we're just now starting to test positive for some of these early on disease processes, and they don't want to go on medications because they know medications are not the solution. The solution is refueling you. How do we fill your tank back up? We don't know that. We will be only guessing if we're just chasing symptoms. I do not want to match symptoms with more pills. We want to have an educated, intellectual approach to how to refuel you, because you do have a limited number of digestive receptors. So you can't just throw a ton of supplements or a ton of things at it, because otherwise you're really just creating expensive urine. You can't absorb it all. So you need to be reserved in how you refuel. There's several different things that we use. Obviously, food always has to be the foundation. Always. You cannot survive with a junk food diet and just putting a whole bunch of supplementation on top. It does not work. Food has to be the foundation. You have to know what you need to eat. Yes, we have to use supplementation because sometimes there's just not enough whole foods broccoli to get you back. Now, in my case, in my practice, I also am using IV therapy because we need some answers fast and we need some very quick refueling. As we go through the process, though, we are able to identify your specific needs. Order your exploratory panel today. Get the answers and the solutions that you need.